If you accidentally contract gonorrhea, often referred to as the king of sexually transmitted disease,
Please allow me to sincerely say congratulations.
this is by no means sarcasm.
Those who frequently engage in commercial sex work likely know that compared to AIDS, which cripples the immune system, syphilis, with its endlessly variable symptoms, and genital warts, which are stubbornly recurrent and hard to eradicate, gonorrhea actually seems relatively well behaved.
At most, it causes symptoms like frequent urination, urgent need to urinate, burning sensations during urination, blood-for-all pain and swelling, excessive discharge and blood in urine.
Although incomplete treatment can lead to infertility, in rare cases it may also cause sepsis, multi-organ infections, arthritis, endocarditis, and even pose a risk of death. Nevertheless, gonorrhea is curable, at least for now. However, as lifestyles become more diverse and sexual practices more varied, gonorrhea infections are no longer limited to the genital area. They can also occur in the mouth, anus, and even the eye, according to World Health Organization data.
In 2020, there were 82.4 million new cases of gonorrhea among adults aged 15 to 49 worldwide.
With such a large infection base, the disease's drug resistance is quietly increasing, even evolving into supergonorrhea that resists nearly all antibiotics. This raises critical questions. Is gonorrhea always sexually transmitted? What other transmission routes exist? How high is its infectivity? And how can we identify, prevent, and address it? To answer these, one thing is clear: avoiding promiscuous sexual behavior is essential.
In this video, we'll uncover the truth about gonorrhea together.
Gonorrhea is one of the oldest and most widely spread diseases in human history. One of the most famous cases involves the British literary master James Boswell. Born into an aristocratic family, he was deeply obsessed with extramarital sexual behavior and contracted gonorrhea a total of 19 times. Remarkably, his wife allowed his actions on the condition that he avoid emotional involvement. Boswell wrote in his diary, "I hold my beloved wife in the highest respect and affection, but I believe physical encounters with prostitutes do not diminish my love for her." Tragically, his wife, who sanctioned his infidelity, eventually became infected with gonorrhea. During her 9 pregnancies, she suffered 2 miscarriages and 1 stillbirth. Due to its long history and widespread prevalence, gonorrhea has accumulated numerous euphemisms. In 400 BC, Hippocrates, the father of Western medicine, categorized it as the disease of Venus, a reference to the Roman goddess of love, subtly indicating its sexually transmitted nature. Based on symptoms, it was once called white turbidity, describing its most common sign, a pus discharge from the urethra, pale yellow streaked with milky white. In terms of treatment, it acquired an intriguing nickname, clap.
Many believe this term originated from a medieval cure for gonorrhea, forcefully slapping the genitals with hands or wooden boards to expel pus and infection.
In ancient China, the physician Zhangzi Dongjing described gonorrhea in the golden chamber as urine, like millet grains, sharp abdominal pain radiating to the navel, meaning urine trickles out in tiny drops accompanied by urethral pain. Thousands of years ago, doctors already documented the external symptoms of gonorrhea, but unlocking its biological mysteries would have to wait until the 20th century. In 1767, John Hunter, the founder of British pathological anatomy, sought to prove that gonorrhea and syphilis were different manifestations of the same disease. He inoculated pus from a gonorrhea patient into his own urethra. Unbeknownst to him, the patient was simultaneously infected with syphilis. Hunter ultimately died from syphilitic otitis. In 1879, Albert Nestor, a German physician specializing in sexually transmitted disease, successfully isolated the causative agent of gonorrhea Neisseria. Gonorrhea run the secretions of 35 men with acute urethritis, 9 women, and 2 patients with acute conjunctivitis. This achievement earned him exclusive naming rights for the bacterium, hence its alternate name, Neisseria gonorrhoeae. However, as many know, mere isolation did not satisfy Couch's postulate. It was not until 1885 when Palmer reported that inoculating gonorrhea into a healthy person's urethra induced gonorrhea symptom, that the bacterium was officially confirmed as the pathogen. Yes, you read that correctly, into a healthy person's urethra. At least John Hunter tested on himself. This researcher directly used others.
But in those days, unethical human experiments were shockingly common.
Even Nestor, after whom the gonococcus is named, injected syphilis patient serum into several non-syphilitic women aged 10 to 24 to study the disease. These individuals knew nothing about the experiments and gave no consent. Later, they all developed varying symptoms of syphilis. Nestor was accused of infecting innocent patients, including children, with syphilis, but he argued the prostitutes contracted syphilis through their profession, not the injection. In the end, he merely received a reprimand and paid a fine to the royal court. Back to the topic, how exactly does Neisseria gonorrhoea affect the human body? On the mucosal surfaces of the human body, there is a protective immunoglobulin called IgA, which acts like landmines pre-planted by the immune system. Once bacteria trigger these mines, an antimicrobial response is detonated. However, Neisseria gonorrhoea secretes a specific protein that neutralizes IgA, completing an initial mine-clearing process. After breaching this defense, gonococci use pili with adhesion factors to latch onto the surface of epithelial cells and begin covert development. Once engulfed by epithelial cells, the bacteria multiply rapidly inside, causing the cells to rupture and dissolve. They then seize the opportunity to invade the subankos. Once inside body tissues, gonococci face direct attack from immune cells. From fearing arriving neutrophils, they worry there aren't enough. The bacteria continuously synthesize new toxins to lure neutrophils into gathering and phagocytosing, their goal to reproduce inside neutrophils. As a result, neutrophils not only fail to kill the gonococci, but become their culture dish. Massive cell death triggers acute inflammation. Symptoms vary by infection site. In men, urethritis is common, initially frequent urination, painful urination, and urgency, quickly followed by swelling of the urethral opening and a thin mucus discharge. Within 24 hours, symptoms worsen, producing large amounts of yellow-white fluid. In women, early symptoms often involve cervicitis and urethritis. Urethritis symptoms mirror men's. Cervicitis causes vulvar itching, burning, increased discharge, and pain during sex. Eye infections lead to conjunctival redness, purulent discharge, and potential corneal ulcers, perforation, vision loss, or blindness. Throat infections mimic tonsillitis or pharyngitis, causing dryness, burning, and pain. Rectal infections may cause severe anal itching, pain, post-discharge, or bloody stool. If left untreated, symptoms may subside after about 2 weeks, but this is not a cure. The gonococci simply hide deeper, potentially causing in men prostatitis, seminal vesiculitis, or inflammation of the vas deferens. In women, endometriosis, salpingitis, or pelvic inflammatory disease. If gonococci enter the bloodstream, they can trigger septicemia, invading nearly every organ: heart, liver, spleen, lungs, kidneys, and joint. So what are the transmission routes of gonorrhea? Data from China CDC shows that the provinces of Yunnan, Guizhou, Sichuan, and the Henan region are hotspots for HIV infection, with Sichuan having the highest number of cases. Gonorrhea, however, is more prevalent in China's southeastern coastal areas and southwestern region. How does Neisseria gonorrhoea spread? It primarily invades human mucosal surfaces. Simply put, if a healthy person's mucous membranes come into contact with mucus pus or secretions containing gonococci, infection is possible. The main transmission routes include sexual transmission, indirect contact transmission, and mother-to-child transmission. If a mother has gonorrhea, her birth canal may contain gonococci. Newborns can contract eye infections while passing through the birth canal, which can lead to blindness in severe cases. Sexual contact is a familiar transmission route, so we won't elaborate here. It's critical to note. A woman has a 50 to 90% chance of contracting gonorrhea, a single sexual encounter with an infected man. A man has a 20 to 30% chance of infection from a single encounter with an infected woman. For context, the risk risk of HIV transmission from a single sexual encounter is 0.03 to 2%, while over 90% of gonorrhea cases are sexually transmitted. Indirect transmission is still possible. Gonorrhea can survive briefly outside the body, 1 to 2 hours in dry environments, several days in hot. This means personal items used by infected individuals, underwear, towels, bed sheets, bathtubs, toilet seats, may become contaminated with the bacteria. The treatment of gonorrhea has historically followed a long and winding path. Early approaches included fresh air, abstinence from alcohol, avoiding stress, and banning sexual activity, followed by experiments with heavy metals like arsenic, antimony, bismuth, gold, silver, and mercury. In the early 20th century, doctors noticed that hot compresses showed surprising effectiveness in treating suppurative arthritis cases complicating gonorrhea. Researcher Santos discovered through experiments that gonorrhea required 76 minutes at 43 degrees Celsius or 37 minutes at 45 degrees Celsius to be killed in vitro. This inspired the urethral irrigation method, flushing the urethra with 46 to 50 degrees Celsius water via a catheter. When water proved insufficient, doctors used potassium permanganate solution. Some clinics even enclosed patients in 41 degrees Celsius heated cabinets for 4 to 6 hours or applied heating elements directly to genital and rectal areas to battle bacteria with heat. In 1935, sulfonamides became the first antimicrobial agents for gonorrhea. By 1933, penicillin emerged as a game changer, rapidly replacing sulfonamides as first-line treatment. For the first time, patients could avoid agonizing procedures and simply take pills. Should a win worth tagging a friend who needs to hear this. But as Nietzsche said, what doesn't kill me makes me stronger. A truth embraced by gonorrhea after decades of antibiotic pressure. Every bacterial generation carries a risk of mutation. When a mutation confers antibiotic resistance, those bacteria survive, breeding hardy descendants. Antibiotics overuse supercharge this process, turning medicine into the bacteria's grindstone. Sulfonamides initially cured 80 to 90% of cases, but within a decade, over 90% of isolated gonococcal strains were resistant in lab tests. Today, many antibiotics, including penicillin, are obsolete for gonorrhea. Ceftriaxone is now the go-to treatment. But in 2011, Japanese sex workers yielded H041, a super gonorrhea strain resistant to all current antibiotics. Experts warned it could spread globally, and they were right. With sky-high infectivity and drug resistance, gonorrhea, it could soon dominate the infectious disease landscape unchallenged. So what can we do? Many students may think they're already doing everything right because they haven't had sex yet, fundamentally eliminating transmission risk. But that's not entirely accurate. Sex is a natural part of life and something most will face eventually. The key is to learn how to prevent gonorrhea and protect yourself and your partner. First, observe before sexual activity. Check yourself and your partner for the gonorrhea symptoms mentioned in this video: unusual discharge, pain during urination, or genital irritation. Second, avoid commercial sex work. Globally, the primary carriers of sexually transmitted diseases are those engaged in prostitution. Many gonorrhea cases are asymptomatic, meaning infected individuals can unknowingly spread the disease. Third, keep it simple. Avoid non-traditional sexual practices obtained through risky channels. While exploring new paths may reduce pregnancy risks, it often increases disease transmission chances. Finally, use condoms, a timeless reminder. Condoms not only prevent pregnancy, but also block pathogens. However, a CDC survey of 312,016 Chinese youth found that 60.2% did not use condoms during their first sexual encounter. Among recent sexual acts, 50.5% skipped condoms with steady partners and 59.6% with casual partners. This highlights a critical need for better condom education. It's crucial to remember contracting an STD does not equal immorality. Many infections occur in consensual relationships. Victims, especially young people, will often engage in unsafe sex due to inexperience or lack of sexual health knowledge.
The worst mistake is avoiding medical care out of shame, leading to severe complications. Doctors don't judge how you got sick. They ask detailed questions only to diagnose complex or typical cases. Always be honest about your medical history. It helps them treat you effectively. In their eyes, you're simply a patient and their only goal is to heal you. That's all for today's content. If you found this helpful or informative, consider following us for more health insight.